This segment sponsored by GBMC Healthcare.
The current epidemic has been recognized as the modern-day form of slavery. We're talking about human trafficking, and it's a huge problem that's affecting our area right here in Baltimore. Here to tell us more and what to look out for is GBMC's Ashley McAree. Welcome.
Thank you. Thank you for having me.
We're excited to have you. This is a very important topic. Tell us about what's happening here in Baltimore.
So we have been having a lot of reports about human trafficking happening in this region. A lot of people are really surprised about this because they have an idea of what human trafficking should look like.
Right.
And this has to do with a lot of the myths that are associated with human trafficking, that trafficking survivors are kidnapped, they're brought from overseas, or it only happens overseas, that they are transported across national borders, that they're usually chained up, and typically that's not how a trafficking victim will look like.
And that's exactly what I feel like it's portrayed to be as. What does it actually look like? What are things to look out for?
So trafficking victims can look like anyone. They can look like you or me. And it really just, there's no profile, no one profile for a human trafficking victim. Just like sexual assault and domestic violence, it can affect anyone, any age, race, socioeconomic status.
So what should we be looking out for when we're walking down our streets, or if we're concerned about something happening maybe?
So for us in the healthcare system, what we look out for, we have certain signs when someone comes into the hospital. So we will look for things like signs of physical or sexual abuse. We will look for some mental health complaints like suicidal thoughts or depression. And we can also look for behavioral responses. So if there's somebody with an individual or with a patient that seems like they're overly controlling, that patient might be fearful of them, they might be resistant to leaving the room, things like that.
Okay. And one of your programs last summer, the SAFE program, was the only program in the Maryland, Washington, D.C. region to present a full-day seminar in D.C., and it focused on many aspects of human trafficking. Tell us more about that conference and what you guys discussed and everyone who was in attendance.
So that was a really great conference. We were honored to be invited. That was put on by the Department of Homeland Security, and we were the healthcare representative that went to speak about human trafficking from the healthcare perspective. So we gave a lot of information about what the multidisciplinary group that attended, what they should expect from their healthcare providers in their jurisdictions as far as what kind of services that they should be able to offer for human trafficking victims and how they can collaborate with them.
That's so important. So why was the GBMC SAFE program selected?
So we have a program at GBMC, an anti-trafficking initiative that we started last year, and that mainly consists of protocol and policy development, staff training, and we expanded our SAFE services to meet the needs of this population. So that was one of the reasons that we were chosen, because we have an existing program.
And you're expanding it and you're making it available to people in Baltimore and DC. What are changes that will be coming up in the next year for that program?
So actually next month we have some exciting news. We're going to be expanding our current unit. So we're going to move to a brand new area of the hospital that will have extra space for us. So unfortunately, we've been seeing a lot more that more than one patient arrives at the hospital at the same time, and we don't have the capacity to be able to treat both. So we are going to be expanding our unit to, we're going to have an extra exam room that's going to be child friendly. So we'll have a more calming environment for our pediatric population, and even down to the paint colors that were chosen. It's just going to be a really nice, calm and healing environment for our patients.
That is so important. Speaking of your patients, if somebody's experiencing or going through human trafficking, can they come to you? What can they do if they're watching this program right now?
Absolutely. So we are available 24/7, 365 days a year. We have forensic nursing services and victim advocacy services that are available. You can come to GBMC's emergency room, and also a great number and a great resource that's national is the human trafficking hotline, and that number is 1-888-3737-888, and that's available 24/7 and confidential for anyone that needs help.
What you're doing is amazing, and it's making the world a better place. Thank you so much for being here on BMore Lifestyle.
Thank you.
Thank you. All right, guys.